Welcome. My name is Adam Rubenfire, and I'm thrilled to introduce today's Modern Healthcare Custom webinar, How Marketing and Brand Can Drive the Trajectory of Health Systems Post-COVID. During this webinar, a panel of 3 leading CMOs will discuss the steps that they are taking to drive positive outcomes for healthcare systems in this new era. Before we get started, we'd like to thank our sponsor, BrandActive, and offer some brief housekeeping notes. We want this webinar to be an interactive experience for you, our audience. You're encouraged to ask questions using the questions pane in your GoToWebinar attendee panel. Our speakers will try to address as many of your questions as they have time for. Should you need any assistance during the webinar, please don't hesitate to contact us via the questions pane in your attendee panel. And now it's my pleasure to introduce Philip Galano, a partner of BrandActive. Philip, the floor is yours.
Great, thank you, Adam. It really is a pleasure to bring such a great panel together for modern healthcare. As Adam said, I'm Philip Giuliano. I'm a partner at BrandActive. Former engineer, org change consultant, and now about 14 years into my time here at BrandActive. For those of you that don't know me or don't know BrandActive, just some context is that BrandActive really focuses in on the financial analysis and the logistics of rebrand implementation and marketing operations. So really what that means is it's if there's M&A, if there's rebrand, if there's partnerships, things of that nature, we do all the scoping, budgeting, and cost analysis, planning, and implementation of that to make that an efficient program. And then we also look at marketing operations when there isn't a big change initiative to really drive efficiency and refocus resources on things that really drive strategic value. So I only share that to share that that's the lens that I'll be bringing to the panel as the moderator today. And I'll also say that we really thank you all for choosing to spend your time with us. I know that all of us are busy, probably most of us more busy than we've ever been. So thank you for taking the time. With the group that we have gathered here, I think you're going to get some really good insights and some good takeaways. So with that, let me go ahead and introduce the panel. Whoops, there we go. Great. So we've got Jigar Shah, SVP and Chief Marketing Officer from Providence. Hi, Jigar. We've got Nick Ragone, Executive VP and Chief Marketing and Communications Officer from Ascension. Hi. And Amanda Todorovich, Senior Director of Content at Cleveland Clinic.
Hello.
Excellent. So from an agenda perspective, really quickly, we're going to be talking about 3 main topics. How healthcare systems are building perception to maximize brand impact. New ways that organizations are looking to marketing to drive better business outcomes. So this is more of a how are we collaborating differently within the organization and relying on each other to drive business results. And then also thinking about and how have our internal priorities or the way that we're looking at our internal operations shifted in order to refocus our resources, think about technology, process, repeatability, that kind of stuff for short and long-term strategic and financial value. So we're going to begin our conversation on the brand side of things, and I thought it would be good to just share some slides with you around some research that we've got from Binary Fountain and also from Edelman. For those of you that don't know Edelman and their trust barometer, it's I think by far the best and most respected global measurement of trust. This spring readout that they did surveyed the general population of 11 of the world's largest economies to ask them to rate their performance of the institutions in responding to this crisis. This research took place in the middle to the end of April of this year. So starting general, really important to see that across government, business, NGOs, media, et cetera, the trust of these things are at all-time highs for the period shown here, 2012 to today. Interesting of note is government is the most trusted of these 4, and that's the first time that's ever been the case. Little split in that is local governments being a lot more trusted. That trust has really increased it. National governments, not so much. That's actually gone down. So just setting the stage, now let's look at healthcare. Healthcare in a 5-month period has seen an 8-point jump. It's the largest jump that Edelman has seen in this, and that's obviously really great. But also coming with that comes quite a bit of risk as well, right? Very short-term increase in trust can also lead to very rapid disappointment if for some reason that trust is not leveraged, not built upon, not delivered appropriately, if there's some sort of betrayal, that kind of stuff. So really great. You guys are at the front lines. You're out there in this crisis. It's very reasonable that there would be a massive increase in trust, but it also comes with a lot of responsibility and a lot of risk. So breaking that down into hospitals, pharmaceutical companies, biotech, you can see health systems at 81% trusted is phenomenal. Pharmaceutical companies, healthcare systems typically lead the overall trust within the healthcare sector, but to be at 81 is a massive jump. So just wanted to share that breakdown real quick. Breaking this down also into, so who do we trust? Doctors, scientists, national health offices, that kind of stuff. Those are the most trusted, and there's some interesting opportunities in that. So having doctors out front, having doctors and scientists lead this messaging, that's all very important. Having them be the spokespeople for the company, announcing updates and breakthroughs in fighting COVID, that kind of stuff. And then on to our fearless leaders. So this is a CEO trust barometer, which basically says there is very high trust in our CEOs, and they're doing a really horrible job, which is an interesting sort of, dichotomy there. Going back to the previous slide really quick, who do we trust? Doctors and scientists. So where is the opportunity? Many CEOs are formerly doctors and scientists. So is there a different role that they can play? And also, is there a role that they can play internal to the organization to engage with employees more, so that employees do understand what the CEO's role is, how they're helping to maintain financial viability, and how they're really driving innovation. So all good data points, I think, to just sort of set the stage on where are we today. So tangible action is needed. Health systems must protect the trust that they've earned. This speaks to the risk element. Really engaging employees, being a source of trustworthy information. Johns Hopkins has done a great job with that. Really being a source of that is huge, and then continuing to prepare for uncertainty and risk. None of us know where this is going to go, right? So how do we set contingency plans and really put ourselves in a good position to maintain that trust and keep moving forward? So I'll end the Edelman element of that there. I mean, if anyone wants to know more, Laurel Butterfield at Edelman leads this study. She has a specific focus in healthcare as well. So if you want to know more about this, I just wanted to give a shout out to them. We really thank them for providing this data just to lead us into this discussion. And then finally, one more slide, sort of looking at binary fountain survey of 3 hospitals and health systems. Where are we spending our time? Not a surprise. Lots of time spent on crisis communications in COVID. Another interesting thing is the decrease in brand investment, and I think we'll touch on that here as we get into the roundtable discussion on whether or not that is necessarily a prudent thing to do. So with that, I will, whoops, one slide too far, everybody. I'm just going to go to our panel there. All right. So starting with you, Nick, I'm curious. As you think about what's occurred over the last 4 to 5 months, is there any insight that you can share with the group around how you guys are approaching brand, thinking about brand perception, advice that you would give on how to handle this internally or externally within the organization?
Great question. Thank you. And thank you for inviting me to be a part of this, and welcome to fellow panelists and attendees. I found that stat interesting. The last thing you showed, we're spending more time obviously on issues crisis management, which is not a surprise, but the part about brand being less significant or less investment, I actually think, and the numbers are borne out in the Edelman Trust survey when you look at hospitals and provider systems having a huge leap. We do our own survey every day in all of our markets about our reputation, brand, and trust, and we've seen that similar type of leap. And mostly because I think, and I'm sure the others would agree, our clinicians have done extraordinary jobs. I think they truly are selfless heroes. For us, though, we wanted to amplify that message, and so we really doubled down on our what I would call qualitative awareness or marketing, which is brand, kind of traditional stuff like TV, radio, even billboards, lawn signs saying that heroes work here. But much of our marketing over the last few years has migrated to quantitative marketing, right? Like digital, online, CRM-based marketing. I like to call it N of 1 marketing, where you're very targeted. But during this crisis, trust, reputation and trust, safety, gratitude for your caregivers has been really important. And we found that investing in qualitative, traditional brand building media has been a critical component, at least for us as Ascension. We're a $24 billion healthcare system. Has been really important in our markets for our associates, our caregivers to see that we're grateful for their work in a very public way through branding and advertising, and then for the community to see how much we're putting, obviously, the community safety, our associate safety first. And so I feel like that's been a really important part of the last 6 months. It hasn't been, from a marketing communication standpoint, it's not just about kind of issues, crisis management and trying to deal with the issue of the day, but also how do we pivot from the goodwill that's been rightly earned by providers, by healthcare systems, by the extraordinary work that we've all seen, not just Ascension caregivers, all caregivers. How do you pivot from that and sort of use this moment in time, this reputational halo that we have to then to elongate it so that it's beyond just a moment, and how to kind of keep that trust. And I think you said it well in your introduction, Philip, with that high trust becomes responsibility, not to squander it, right? Not to fail, not to let the community, patients, our caregivers down. And so I've been thinking a lot about that, and I've really been thinking as a discipline for marketing and communications, particularly in the healthcare space and the provider space, this is our moment to help shine because we're storytellers, right? We tell stories, and we've never had a more extraordinary story to tell about our caregivers, our collective caregivers, becoming heroes. They're part of the fabric of their communities. They're selfless. I mean, we've seen the images over and over. And so I think it's a privilege to be able to tell that story, and we're using all the channels at our disposal to do that.
That's great. Jigar, do you have anything to add to that?
Yeah, I think, great question. I think to Nick's point, we've done the same thing, increased actually, and it depends on how we define the brand spend. So, if we just look at the ad spend, it's probably going to give a not accurate picture of the investment that we're all making in brand right now. For us, it starts with making sure that we are listening constantly. So we work with Edelman. We also have worked with Binary Fountain, NRC Healthcare, and other national surveys, but we also built a large community of insight, our patients are 15,000 plus over the last 2 years. So we are actually doubling down on that listening capacity, going out every 2 weeks, asking our patients in footprint, what matters to them, how they're feeling, and then responding that in the content we put out, because it has to be, to your point, they see us as a trusted source of information. So we have to make sure that that the information we put out is real. It's based on facts and real time, because there is so much misinformation out there almost every day. So we put up, and so I consider all of this investments, whether it's the investing in research or investing, we put up similar to Johns Hopkins, we put up our coronavirus.providence.org COVID hub in, I would say, less than 48 hours since, this began. And that has been the content hub. And the way I see it is that's an investment in our brand, because we get about 20 to 25,000 unique visitors every day on that hub in our footprint, patients and community looking for information on topics that are concerning. There's misinformation, and then they come to us and say, okay, what do you guys think about this? Because I trust what you say. So I think that's an investment in brand, and it's a win-win, because it only, it's not only gives the information that patients need, but it also is building your, from a marketing and brand perspective, it's actually building the Google Content Authority. So when you think about SEO from a marketing perspective, it's going to go a long way putting out the right content right now. And then the last one is for us, we have found a really good strength in partnership through this time. So, we've launched, Dr. Rhoda Weiss brought us together about back in March in LA. End of March, early April, as the first wave was tapering off, and a lot of us in healthcare saw that people were holding back on necessary and life-threatening care. So we wanted to go out and talk about don't delay care, public service announcement. Our EDs are open, they are safe. The idea was, it's a public service announcement. Why don't we unify our voice instead of so many health systems in LA going out with the same message? So we did. We unified the voice. We put 6 health systems in one campaign. We went out. So on the top, on the outside, you might see like total brand spend has reduced, but the voice has amplified by combining. And so we actually have done more than half a dozen such consortium-based brand qualitative public service announcements since then. I think it's very effective. It's very good for the community and public because they get to hear one voice, one message from the health systems. It's great for us because we actually get to save on media spend, and we're partnering. So that's what we've been doing, and I think we'll continue doing that as long as this has turned from a sprint to a marathon. So
what you just raised two other questions that I want to touch on, and those of you that have worked with me know that I kind of think a little bit organically and shift things. So I'm going to surprise you with a couple questions we didn't prepare for coming up. But Amanda, I'm curious on the messaging side that Jigar just brought up. As we think back to the trust element and we think about how we're communicating, particularly Cleveland Clinic with all that you bring to the table, what sort of message are you guys taking out right now, and how are you looking to capitalize on the trust?
Sure. Trust is at the core of everything that we have been doing for a very long time. And our content strategy, similar to what Jigar was talking about, I mean, we've been putting out COVID-related articles every single day since mid-March, and we haven't stopped. Really trying to be as empathetic as we can be to the general population. This has been a complete emotional roller coaster for people. And so we're putting out content not just about, coming in for care, although that's obviously an important part of it. It's also about just surviving this, right? And dealing with the mental health issues that come with it and the boredom that comes with it. And what does this mean for your children who are no longer, seeing their friends every day? And just really trying to think through as many of those scenarios and issues that people are facing and trying to help and be there and support them through this. And like I said, not just about coming into EDs, although we definitely did similar things and had our own campaign around that as well. And have invested, in a safety campaign and ran a TV spot with our CEO talking about what we've done to make our facilities safe and make it okay for people to come back in for care. But, really, truly still staying relevant every day and knowing that we're there for you through this health crisis. And, others have said it, we're in the spotlight right now, and it's really important that we take that privilege seriously. And that, it's not just about us. And while, it's been amazing to see the recognition for our caregivers and for the heroes that they are, it's also very much about just the general population and people and how they handle this and deal with this and get all that crazy misinformation and what we can do to help really provide factual, accurate, updated information as much as we possibly can. We have a huge responsibility with more than 2 million Facebook followers, 2 million Twitter followers. Like, there are people all over the world looking at us, and again, taking that seriously and really trying to be there in every moment at every turn.
Mm-hmm. Yeah, I'm interested. This is the surprise question part of the conversation. I'm interested in, all three of you are, large systems, right? And so when we think about message and we think about fact and trust and data and all of that, what advice would you give people on the system level aspect of things versus what happens at the local level? What is the role of the system at this time?
It's a great question. I'll chime in first, just because we're a large system. We're in 20 states. We have 2,700 sites of care. So we are a very broad system, 160,000 associates. But about 5 years ago, we started to integrate ourselves. We called it our One Ascension journey, where we really brought our clinical operations and our brands into alignment. So 5 years later, now we're fully Ascension branded, all of our sites of care. We're a very integrated system. I think it's been a real benefit to us we set up a command center in late February around COVID. It's allowed us to be really nimble and flexible in responding to COVID as a system, versus if this was 5 years ago, we would have done it in a very one-off way. And each one of our hospitals literally had to have tackled all these issues, from CDC guidance to changing out your messaging to clinical protocols and everything else. And so I can't imagine what that would have been like, but I know it would have been challenging. And so, you know, our leadership 6-7 years ago was very prescient in trying to create a more integrated system. And so our response has been, I would like to say, very directional. It's been led by our national ministry, our system, with great coordination from each of our markets and a lot of feedback. And we had a daily, you know, and I'm sure other systems do this too. We had a daily call, 7 a.m. every morning with our top leaders across the system and really understood what the issues of the day were. But it was a very integrated response, and I feel like it really allowed us. It actually accelerated our One Ascension journey, but allowed us to respond in I think a much more timely, effective, concerted way versus, you know, sort of letting each hospital system try to figure it out on their own. And so I feel very fortunate that we've laid all that groundwork the last 5 or 6 years so that it allowed us to really have a timely, concerted effort in response.
Yeah, almost identical story here. We're one Cleveland clinic, and we definitely rallied around this in that way and centralized as much of the messaging and communication as we could, try to really use one home landing page for information that then could be shared and utilized, assets shared across the entire enterprise creatively, and just really trying to manage a lot of fast changing things. I mean, policies were changing every day, trying to make sure they were consistent as much as possible across different locations. And it also led to, you know, support from staffing where we needed to send caregivers to Abu Dhabi, for example, to support the team there. I mean, daily conversations every morning with our command center and streamlining also approvals on things, just really trying to be as consistent across the board.
You know, it's the same thing, right? So we're going through this journey of sort of unifying our brand, but in the back end, the operations was, I think it's like 1 + 1 = 3. So we have the system level response, but you also have to have a regionalized response because like Nick, and we're spread out in several states and several markets. And when we set up those 7:30 morning calls every day with 200+ system leaders and regional leaders and caregivers joining to align on key updates, but also take the action items. So on the marketing side, we set up a rapid response team that had people from the system team, what we call the services side, and then also the regional teams and communication and website team to make sure that that the regionalization of, as appropriate of the action item is happening. Like when we had peak, we saw the first patient in the country at Providence Everett Regional Medical Center back in January. And, we set up within 24 hours of seeing the first patient, we set up in Epic, the screening protocol, and that goes in Epics across our system. But then there were markets back in January in SoCal, in Texas, that we served. There was no COVID-19. And so, the reality is that even now, we have surge in one market and, decline in the other market. So we have to make sure that, the rapid response team that we put up isn't just sending out one and done kind of message across all the communities we serve, but it's contextualized, it's personalized, it's aligned with the state protocols and governor's guidance, because otherwise it creates a cognitive dissonance. So what we have done is a lot of centralized response around supplies, PPE, or the operational response is centralized because you can move pharmacy and PPE where the need is. In terms of marketing messaging, we've allowed the regional approach because that's what the reality is right now. Different communities are facing different wave of COVID.
Yeah, let's shift to money real quick, and I think let's get a little audience participation and throw up our first poll question if we can.
Absolutely, I will blow it up right now. Audience, how are marketing budgets shifting for 2021? Let us know. Is it a large increase, so greater than 25% increase? Is it increasing, 1 to 25% increase, remaining the same? Is it decreasing, 1 to 25% decrease? Or is it a large decrease, greater than 25%? We'll give you about 30 seconds, 45 seconds, and Philip, in the meantime, I'll throw it back to you.
Yeah, while we're here letting this stuff tabulate, you mentioned something about partnerships, and since we're on money, I wanted to throw out to the group, and we'll revisit the poll here in a second, around where are you guys pushing yourselves from a revenue driving perspective, creativity perspective, to look at new partnerships, new revenue streams, that kind of stuff.
Yeah, I think some of this is going to depend on where healthcare goes, right? How is this going to accelerate or slow down the shift to value-based care, right? So some of the partnership discussions sort of wait for that trend to emerge. In terms of marketing specifically for us, we really have appreciated the spirit of partnership in the public service announcement campaigns, whether it was the 100 million mask challenge that we launched back in March, when the PPE short supply was acute. And, within 48 hours, we had pulled together 5 apparel manufacturers who were ready to make masks and engaged 30,000 plus in the community, folks who wanted to sign up and sew masks for frontline caregivers. Believe it or not, that whole website we put up together in 4 hours. I mean, back in January, if somebody had told me that, hey, you're going to have a national campaign launched in 48 hours and a website in 4 hours, I would have not imagined that, but it happened. And I think, since then, and now that campaign has become a national campaign under the auspices of AHA. But this, the campaign that I mentioned that we ran in LA around Don't Delay Care sort of became, a really good best practice for us. In Washington State, in Oregon, we work with state hospital associations or other healthcare providers to go with a unified message. I think as long as this sort of a public, this health crisis continues, we look forward to actually applying that model more. It's a really good win-win. Not only it saves the media spend on each of the health side, but also from a public perspective, it's a unified joint, one common message that reduces confusion out there. So that's the partnership I mean from the marketing perspective. I'm sure there are other commercial partnerships that will shape as the healthcare itself decides which way it's going to go.
Yeah. I'll shift over to you in a second, Nick, but I'll end the suspense really quickly on the poll question. Not necessarily surprisingly, we had about 50% of the people voted on this, and 1% is actually seeing a large increase in their budget. 22% are seeing a slight increase in their budget, 29% remaining the same. So, add that up, you've got about 50% increasing or staying the same, and then you've got about 47% decreasing. Most of that being in the large, in the smaller decrease, 1 to 25%. So, just thought it would be good to level set with everyone around what we're all experiencing today. Nick, I know when we were talking prior to the webinar, you had some really good insight around sort of how you've driven the business case for the investment in marketing, and so I wondered if you wanted to share some of your perspective around how you've been able to double down on some of the things that you've been doing.
Yeah, I thank you for the poll, by the way. And there's probably nothing shocking in there. I think it's all somewhat intuitive. But the last couple of 4 or 5 years, I've actually opined in modern healthcare and elsewhere about how marketing needed to play a greater role in provider, in healthcare systems, large integrated systems. It needed to have a bigger role at the table. And I think in general, there is, because there's so much change going on in healthcare, has been over the last 5 years. And it's not just a move from fee for service to fee for value, but consumer orientation, technology, so forth, that marketing communications, particularly marketing, plays a much more important role than it ever did, for the last 20, 30, 40 years. And I think all that's been accelerated really the last 6 months, the last 8 months, because we're kind of in a new era. We don't really know yet what the light at the end of the tunnel is going to look like, but we know that it's not just healthcare healthcare behavior that's changing. Across society, COVID is a disruptor, from working remotely to healthcare delivery to living in cities versus rural areas and that sort of thing. And so we know behavior is going to change in a pretty dramatic way. And so now is the time to really sort of, take some of that goodwill that's been rightfully earned by our extraordinary caregivers, the trust that you saw in the Edelman numbers for clinicians, for providers, for healthcare systems, and figure out, how do I make sure that I'm meeting consumer needs going forward? Because we don't really know. I mean, we're doing a lot of research every day with consumers, qualitative and quantitative, to understand what the new landscape is going to look like, but we're still in the middle of it. We don't, we don't even have a vaccination yet or advanced therapeutics. So we're still in the infancy of understanding what's the world going to look like 6 months from now, 12 months from now, 3 years from now, 5 years from now when it comes to healthcare. And so I think it makes it even more important for us as marketers and communicators, not just to have a voice at the table among leadership within our systems, but to communicate to the public and to sort of understand what this pivot's going to look like and what they want to see in us as providers and healthcare systems when it comes to, safety, when it comes to associate care and how we're treating our own associates, when it comes to telemedicine and contactless care, when it comes to, fee for value opportunities and so many other issues that we thought we had a handle on 8 months ago, and now we don't really know. I find that uncertainty exciting because we know that we have some wind at our back when it comes to reputation. We know that the public we've earned that trust through our amazing caregivers. We know that there's still a lot of uncertainty about what the future holds. And we know that, being communicative and hyper transparent has been really beneficial in general to healthcare. And now's a chance for us to kind of leverage all that and pivot to where the consumer is going to go in a post-COVID landscape. And so I've been arguing for 5 or 6 years that marketing as a discipline needed to have a much greater role in healthcare and provider systems. And I'm sort of doubling down on that. I mean, now more than ever, that reputational trust and that consumer awareness and community engagement and advocacy is going to be so critical to coming out and landing someplace where we could be of real value to patients and consumers after COVID.
I think too, it's really important to note how many other industries are turning to us for help as well, right? As we try to figure out what all this looks like going forward, we have, airlines coming to us, help us figure this out, schools coming to us, other employers. Employer health is a huge thing, and they're all coming, asking for support, asking for help, asking for consulting. And so, there's every industry turning to healthcare for support. And it's just a huge opportunity for us as an industry to really step up and to kind of help inform and shape, the future of what this all looks like. And we have a huge responsibility to do that.
Yeah, no, definitely. And since you talked about, other groups coming to you, other industries coming to you, I'm curious about other areas of the organization coming to you. We've seen a lot with our clients where, the partnership between finance, operations, other areas of the organization is actually thriving during this time as everyone's trying to figure out how to collaborate better and get better results. So from your actual experience and not my consultative experience, I'm curious what your perspective is on that.
Yeah, I think, go ahead.
I was just going to say, I don't think that we've ever been more collaborative than we've had to be in the last 6 months. It really forced it to happen under a lot of duress. But I think that the relationships, the conversations, the frequency of interaction is sustainable and should be sustained as we move forward. It just really, I think, expedited so much of what's been needed for so long. But yeah, across the entire system.
And specifically though, for all of you, I mean, to do what? What's the difference? Not just in the collaboration, the dynamic, but what are they asking of you, and what are you asking of them?
I think the big ask that we've seen, and this daily calls, the 7:30 morning calls, have been really guiding force in keeping a lot of teams that are cross-functional teams that are, working on meeting the patient needs and caregiver needs. And so we've seen, like, for example, we saw telemedicine go from like daily 50 telemedicine visits to more than 10,000 a day. So, great that the technology team was there and they scaled up and they met those successfully. But then they want us to go out and tell the patients that, hey, this is there. You don't have to delay care. And so the communication, the personalized patient communication has been a big ask. Outside of the public service announcement kind of campaigns, we had the EICU, remote home monitoring system that stood up and scaled pretty quickly. So operations in the back end has been solving a lot of operational challenges. Finance has been solving financial challenges, cash flow challenges. Technology team, our technology team worked with Microsoft and, really upgraded our AI-based chatbot to actually direct patient care early back in March, and we launched that within a week sort of starting all of this. Their ask is, hey, we built this, can you go tell the patient that this is available to them? And on our side, the big responsibility is how do we, number one, tell it so that it's personalized, it's using the right tone, it's empathetic, but at the same time, we are not doing a message fatigue to our patients, right? So how do we package it all up and deliver it in a more meaningful way? So that's been the big ask, patient communication.
Yeah. Nick, anything to add there?
Yeah, I would say I agree with everything. And the one thing I'd add is, and this wasn't a lesson learned for me, but it was a reminder at the importance of internal communications, and that, you know, we have 160,000 associates spread out over 20 states. And so it's always been, you know, not a challenge for us, but, you know, we've always had to work hard to make sure that we're reaching all of our associates in many different ways, because many are caregivers, they're not in front of their computers or phones all day. And so you have to find ways to really reach them. And during a crisis, internal comms is really the glue that keeps a lot of the crisis response together, not just the marketing piece, but even the you know, from setting up a command center to having the daily calls, to daily recap calls, and all the other things that all of us, I'm sure, have done. It's just another reminder for me that, you know, internal communications and really being able to, in real time, be transparent in your communications with all of your associates has been so critical for us to accelerate this One Ascension journey. There's been a trust in Ascension as a system responding in one way, because you know, frankly, I think the communications has been really, really good internally, and it's sort of helped garner some of that trust. And I think it's critical to responding during a crisis. I mean, and so it's just, you know, our brand journey was a reminder for me that it starts internally and then is external. Every major initiative I've ever run across as a communicator, it's always a reminder to me that you sort of start internal and work your way out. And the same is held true for this.
I would echo a lot of that. And the other thing that I think was a big challenge during all of this is that we suddenly had a huge percentage of our staff working remotely, and it completely changed some of the tools and the technologies and the ways we could reach and connect with our caregivers. And, you know, especially when we were trying to communicate things about when and how to come back into the facilities and all of that kind of information, and also to other referring providers and how to really stay in touch with people. We launched several new pieces of communication, new websites, new landing pages across the board for lots of different audiences. And I would absolutely echo that. Communication with patients is the biggest request. We've definitely dramatically increased how frequently we're reaching out to our entire patient database, sending out actually a weekly communication from our CEO to our entire patient list. Is something that we launched in the middle of all of this and continue to do now. And, you know, it's the list is never ending. The amount of work that we've done is massive and extensive, and again, a lot of it will be sustained. And I think it's really highlighted how we can connect better with patients and how we can really, like Yegar said earlier, really listen to them and understand how we can help.
Yeah. Okay. Well, let's grab a little bit more audience participation and drop into our next poll question as we shift into marketing operations.
Excellent. Thank you, Philip. We'll launch our next poll. The next poll is, which area of your brand and marketing operations would most benefit from being streamlined? That poll is going to be streamed to your computers now, and you can go ahead and start voting. The options are marketing and technology suite, standardized, repeatable processes, evaluating how we work with current vendors and agencies, current use, ROI, quality, and consistency of branded assets, or free up marketing resources to focus on strategic actions. And you're going to choose one, and we'll give you some time. But Philip, I'll take it back to you.
Yeah, I mean, I'm just curious. Maybe Yegar, where are you guys focusing?
You know, I think it's not. I mean, it's all of them, right? And we have to, because we are looking at MarTech stack, and we had invested quite a bit in the CRM and automation in the last 2 years or so. So, you know, we're getting some rewards from that, but we are looking at investing more in data compliance and also, you know, the attribution model to answer the question that's eventually going to come from finance. If there's an increased investment, you know, where's the return? So we are working on that. I think, you know, we are looking at having marketing resources, some of them freed up to work with our clinical teams, with ops teams. You know, we're looking at end-to-end patient journeys and see how, you know, this is going to change the patient journeys, whether it's going to telemedicine or some other options, and how marketing can actually be a part of that, you know, journey of resolving patient pain points. So to us, it's all of that. The biggest one that we want that we are actually spending a lot of time on right now is the standardized, repeatable processes. I think we've all, I'm sure all of us in this audience, we've all found this new muscle called agility that we had not known until last year. And I think the question is, how do we keep up that? And a lot of that answer comes from actually standardized, repeatable processes. A lot of the work that has gone out, which is very agile right now, has been very manual. A lot of that through collaboration, good relationship, good partnership spirit between teams. But simplified processes and repeatable processes can solve a lot of that going forward, because as this goes from, like I said, from a sprint to a marathon, there is certain level of fatigue setting in our caregivers also, right? I mean, everyone has been responding, not just marketing, but operations, finance, supply chain. Everyone has been responding at 120% of their capacity, and there is only so much that goes. So fixing process kinks and making things easier for our caregivers, as we call our employees, is like #1 priority right now for us.
That's great. I'll come to you, Amanda, in a second, but just looking at the poll results, these are actually surprising to me. 9% are investing in the marketing technology suite, 24% standardized repeatable processes, 7% evaluating how we work with our current vendors and agencies, 31% on the current use ROI, quality, and consistency of the assets that we have, and then 29% on freeing up marketing resources to focus on more strategic initiatives. Before I come back to you, Amanda, I wanted just to share a perspective with everybody on the line, just to think about marketing operations, because it's an area that a lot of people, especially in healthcare marketing, where you're responding to things and active and reactive so often of the time, that to take a holistic look at how we do what we do, who's involved in all of that, how repeatable is it, how standardized is it, what is the ROI of those things, taking that kind of a holistic view is something that people don't generally get the chance to do. So I want to just throw this framework up and highlight a few things, right? People, processes and assets, technology and training, right? Roles and responsibilities, vendors, agencies, guidelines, documentation. Do you have playbooks, right? Are your processes and the way that people are doing things squared away? And do you have the technology and support models to support them, right? That's kind of the things that you look at to evaluate where are the opportunities. And then you look at, do I have performance and tracking and dashboards and ongoing support and that kind of stuff. The other thing I want to mention is on the right-hand side, right? That it's an easier thing to look at, what is marketing doing? And where can I find the money within marketing? There is also brand experience, patient experience, marketing asset, brand asset, things happening in IT, HR, facilities, fleet, all these other areas, right? And these all represent opportunities for marketing to play a different role. M&As, for example, right? Nick mentioned getting marketing to the table earlier in very strategic discussions. That's a huge miss for a lot of organizations. So thinking about how are we involved in these things, how should we be involved in these things, what are we spending on those things, how could we be spending less, and where are the efficiencies? I just kind of wanted to throw that model out there, and then I'll toss it back to you, Amanda, and say, how are you looking at operations at Cleveland Clinic?
Yeah, right now, definitely a big focus on CRM and marketing automation for sure. And also really a lot of workflow issues, because like I said, we've started a lot of new things during this pandemic, and that means we have to figure out how to sustain them, right? In a crisis, it's all hands and everybody just jumps in and we just get it done. But then, when you pile on more and more of those things, eventually, if they're going to continue for long periods of time, you have to figure it out and really make sure that they're actually delegated and assigned to the right people and going through the most efficient process possible. And, there were circumstances where we had to make decisions in minutes about a vendor to do something that we weren't set up to do before. And so now it's kind of backtracking a little bit and looking at all of that and making sure that we're, again, doing the right way, setting up the relationships longer term, looking at what's working, what's not working, what did we do during the last 6 months that we want to improve upon or potentially build on. And that's really, I think, where some of our CRM work and automation work are coming into play now, where we've looked at things like unfulfilled orders, for example, how many patients have procedures they're supposed to be coming in for and aren't, and what's that outreach look like? That's not something we would have done before, right? We would have really done more of the service line approach, the way that we've traditionally done. And so, really slicing and dicing what's going on with different patient populations in different ways today. And really, again, understanding the tools, the technology, and most importantly, the workflows to make those things happen, because our structure is just not really there yet.
I'll switch over to you, Nick, real quick on this topic as well, operational efficiency and where you're focusing, and then we'll have one more question and switch over to Q&A.
You know, I agree with much that's been said. I do think, you know, there's so much, we're focusing on our Marcom stack. We've been doing that work for a while. And I think, you know, after we get through this initial phase of COVID, whenever that ends, we are going to return to something that looks like normal business. And I think, you know, focusing again in a very, tactical, specific way about, you know, different groups are going to want to hear different things from us when it comes to coming back to our sites of care, whether it's elective surgery or primary care or using urgent care, the ED, and we need to be, as marketers and storytellers, really aware of, more than ever, that customer sentiment around the particular site of care that might be important for them or their condition state. It could be a service line, it could be oncology, heart care, whatever it might be, but they're all going to be filtered now through this kind of COVID lens, and it's going to be a lot of work for us to understand that and then use the right channel to communicate, a message that is inviting for them to come back and get that hip procedure, or to, make sure that they're doing their pediatric visits or getting their colorectal screening or whatever it might be, or using urgent care, the ED, properly. And so part of it is, I think we're going to need to put aside a lot of assumptions we've used for a long time about patient journey, segmentation, messaging, sites of care, that sort of thing, and sort of say, okay, let's understand how they've been shaped over the last 6 months, and maybe some sites of care and some types of services and some condition states won't have been changed that much, but my guess is they all will have been impacted. And I think it's really, again, it's so important for us, not just as marketers and communicators, but as strategic partners, to really understand that, because that's the crux of getting back to kind of normal in a post-COVID world. And that's a big responsibility and opportunity for marketing and communications as a discipline to really drive that new consumer patient journey map.
Yeah. All right, I'm going to switch over to Q&A now, because I want to make sure we get some good audience participation. I've got another question for you that maybe we'll wrap up with, but actually, we have got the question I was going to ask you. So what advice would you give regional, mid-sized, small health systems looking to improve their brand operations? What have been your go-to research sources when it comes to consumer references and trends throughout COVID-19?
Yeah, I think, so I work for a large healthcare system, but I started my career in a very small company. And I think when it comes to small organizations, there are some inherent benefits, inherent strengths that you can tap into that I don't necessarily feel like we have access to at a large systems. Usually in the smaller organizations, you have what I call Swiss Army knives, a lot of people who can actually play so many roles very effectively, and that actually makes the process very nimble. So take an example of patient communication. Getting a patient communication out could be a lot more faster at a smaller organization than a larger one with footprint in multiple states and multiple regions with different realities of COVID. So, you have an advantage to a large system in your market in just getting out in patient communication. Media mix is the second one, I would say. Pay close attention to the media mix. And, right now, everyone is looking at an email from their physician's office or their healthcare provider. The email open rates have jumped through like the roof for us. And so, this isn't the time to be spending a lot of money on paid media. This is the time to doubling down on personalized email communication with facts and information about clinic hours, etc. And that goes a long way without a lot of money. And speaking of clinic hours, just tap into free or low-cost resources like just managing Google My Business for your clinics and making sure that the clinic hours are posted accurately, because that's where a lot of people will go and see if they want to see a physician, not go and check our emails. So just using some of those low-cost resources can be very effective also for smaller systems and for everybody, for all of us. We manage that as well very well to tap into access and reach to the patients.
Mm-hmm. I would say too, leveraging your own data, what's happening on your website, what are people going to, or your site search data, what are they typing in and trying to find? How can you help them? Do you answer the right questions? And also, understanding what kind of calls your call center is getting, You know, what kinds of questions are people calling and asking, because they will ask everything of the operator. You know, we've started weekly touch bases with the leadership of those areas to just understand, so that we can, you know, align the website to the call center, you know, frequently asked questions types of things. And so I would just definitely make sure you're tapping into the things that are at your fingertips every day.
Yeah.
Yeah.
Okay.
I don't know what to add other than I think even if you're a smaller, mid-size or smaller system, don't overlook the importance of continuing to do consumer research, both qualitative and quantitative. Find either a good partner. We do it all in-house at Ascension, but I just think it's going to be so critical to understanding the landscape, and that we shouldn't make assumptions based on, you know, information in the public domain or anecdotal evidence we're hearing from caregivers. It should be a full sort of picture of, you know, secondary research in the public domain, you know, stuff that we're hearing from caregivers, but then, you know, marketing and communications doing both, you know, qualitative and quantitative research continuously to truly understand as a country where we headed when it comes to expectations around healthcare delivery. I just think that's going to be such an important piece of what we bring to the table as communicators and what health systems bring to the table in a post-COVID world. So I would find the resources to make sure we're investing in that.
Yeah, I think that's a great point. And the only thing that I'll add to this is, you know, as we looked at the budget element of this, right, the smaller regional mid-sized health systems are typically the ones those budgets are being strained. So, you know, looking back at that model for marketing operations, I would take the time to look at how you're doing, what you are spending your time on, what resources you have, that kind of stuff, repeatability, simplify everything you're doing. You know, it can uncover a lot. So another question, I love these questions. What is keeping you up at night? That is the basic gist. As healthcare communicators and market leaders, what is keeping you awake at night? Has that changed since the beginning of the pandemic?
For me, it's just how quickly things are changing every single day, whether it's about masks or visitation policies or, you know, just testing facilities. I mean, we've been evolving so fast, and it means updating and changing so many things. And the last thing we want to do is provide the wrong information to patients. And so just the constant need to stay on top of it and stay accurate and updated is very stressful.
Yeah, you know, for me, it's similar in that, you know, part of the challenge for all of us is, I would assume most of us are still working from home or partially, is, you know, the blurring of days and the blurring of, you know, your day starts when you wake up and it ends when you go to sleep. And in between that, you get emails overnight and you got to adapt to the latest, you know, issue that you might have, or guidance or outbreak or whatever it might be. And so, honestly, the thing that keeps me up is trying to find a little bit of symmetry in the balance of life now that we're past the initial sprint phase of this and the adrenaline's wearing off and we're in for the sort of marathon phase, is finding, you know, a healthy balance, not just for me, but for my whole team and for everybody that we work with, that are, you know, going on 5 or 6 months of working remotely and adapting to that, but also trying to figure out, you know, in this new world, what are sort of the boundaries of where you can still preserve a little bit of downtime to be with family, and at the same time be responsive to just the never-ending wave of things that come at us. And so that really has been the biggest challenge.
Yeah, I think similar to that, it's the well-being of our employees, our caregivers, because like Nick said, this has gone on for a while now, and it looks like it's going to go on for longer. And when I look at the rapid response team that we put up with 19 caregivers, you know, from different teams together, that team has gone through and produced so much work in the last 4 months that we would have looked at that and said that's a couple of years worth of you know, campaigns and efforts that got processed in 4 months. So you know, making sure that the caregivers are staying happy, healthy, and you know, like Nick's point, 24/7 work from home now. How do we not do that? And then also the second thing is keeping time aside for thinking, because there is always doing going on right now. So one of the things we introduced last month was, at least for the summer, meeting free Friday afternoons in marketing team. That's your time to think about things, you know, next steps. Just take time off if you want to take time off. But it's simple stuff like, you know, how do we find time to think about versus just always in the do mode?
Yeah, you remind me of a good book I read once called Deep Work. taking time to think and be strategic. One more question here from the group. What do you see as the trend for M&A and partnerships in the healthcare industry? What are you watching out for?
I mean, I think there's going to be, you know, in the next 6 to 12 to 18 months, quite a bit of consolidation in general with providers, with payers, with everybody, just because we know that, you know, as a country, we're going through some, you know, the most disruptive economic times in 70 or 80 years. And so there's no doubt that there's going to be a lot of activity in the healthcare space in general. And I don't want to get too predictive on what it all means, but I would assume we're going to see, you know, as we continue, you know, and we don't know where this is really going to bottom out yet. We're still waiting to see where the vaccinations go and therapeutics, but I think we're going to, you know, start to see some just consolidation within the whole healthcare space, as well as other industries too. I mean, I think there's going to be a lot of business activity going on as industries try to figure out, you know, a new footing in not just a changed healthcare landscape, but really a changed country and world. I mean, the way, again, we organize ourselves, the way we work, the way we, you know, the way we consume healthcare, the way we congregate with each other. There's going to be a lot of, I think, a lot of disruption and change across all verticals.
Yeah, I don't know about the like formal M&A kind of, but the strategic partnerships will come forward in the space of, you know, access has been a challenge. And, you know, when we look at the rise of telemedicine and adoption of it right now, you know, I fully expect strategic partnership between providers and tech companies on improving the access and scale up of telemedicine. The second area, you know, what we're watching, and we have invested on this for several years now, is the mental health. And, you know, as this goes on for a while, there will be partnerships that will need to be formed in the space of mental health to keep the communities mental health intact and grow. And, you know, the message of hope needs to come out soon. And so that's where we think more strategic partnerships will start shaping up, and not so much as formal M&A yet.
No. Amanda, anything to add?
You know, not really. I agree with everything. I think, you know, we're in really crazy, unprecedented times, right? I mean, between the pandemic and it's an election year and who the heck knows what the future holds next. I think, you know, we're just in for a lot of change, and we just kind of have to be prepared for anything at this point.
Yeah, agreed. Well, I would love to keep going on questions here. There are some here that, you know, maybe we'll be able to follow up and answer, but you know, I will answer the what's keeping me up at night question as we sign off, and just say that I have over 20 healthcare and health system clients right now, and what keeps me up at night is your guys' sanity, health, and well-being. I don't know how you do what you do, and I really appreciate it. So thank you for the panel for joining, and thank you to everybody else for joining the webinar. I do understand that we'll share and distribute the slides that we've used here as well after this, and thank you everyone for participating.
Excellent. I'll take it from there and close us out. Thank you so much, everyone. It takes us to the end of our presentation. Thanks again to our moderator, Philip, and our panelists, Nick, Amanda, and Jigar, for your contributions today. And thank you to our audience for such great questions. To our audience, we value your time and feedback. Please take a moment to fill out our brief post-webinar survey so we can provide the best content and resources for you. We'd like to thank the sponsor of today's webinar, BrandActive. For more information, please visit brandactive.com. And as Philip said, this webinar will be available on demand, and a copy of the slide deck and a link to a recording will be emailed to you within the next 48 hours. Concludes today's presentation. Have a great day, everyone.
Thank you.